Welcome to the Healers Café, conversations on health and healing with Manon Bolliger, a retired and deregistered naturopathic physician with 30 plus years of experience. Here you will discover engaging and informative conversations between experienced healers, covering all aspects of healing, the personal journey, the journey of the practitioner, and the amazing possibilities for our own body and spirit.
Welcome to the Healers Café. And today I have with me Diane Fownes, who's a registered nurse with over 36 years of extensive experience in various modalities of healthcare. And this includes kinesiology, naturopathy, Bowen therapy, myofascial release techniques, cupping, and TMD. And I've known Diane for, I don't know if I can do the math, but quite a while.
A minute.
But anyway, so I welcome Diane, and just before I turn the record button, we were talking about licensing because we were catching up, and Diane lived in New Brunswick and had a practice there and has moved to what is it called again? It's
Carmel, California.
Carmel, yes, I love Carmel. Yeah. I just can remember the name. Anyway, so we started discussing, and then now we're on record. So, well, why don't you put me a little bit up to date with how you've been and why you moved and what has happened and how does it impact, your license, your licensure, all of that, because so many, at least in Canada, healthcare practitioners are, have done their research, actually have looked at the science, as in they're following, scientific reviews and are not willing to take this thing. I can't use the word, or then we can't even be heard. Beep the thing, to prevent something that is otherwise 99.9 whatever percent, non-fatal. So, and that's caused such a discussion in amongst healthcare people, all the way from, oh, you've got this training. Oh, are you still licensed? No, I don't care. That's fine. You know what you're doing. To, oh no, how am I going to get a certified person that really will listen to me because I actually have injuries and they don't even understand that I am injured because they're following, this cookbook approach of there are no side effects. So it's just been a wild time discussing both with, I'm no longer in practice because I lost my my license as well. I decided to deregister officially because I really don't want to have anything to do with a profession and a board that is.
I love it.
That is so supposed to be about health. Right. And the premise of health is we should have choice because we don't have all the exact same bodies and the same history. Anyway, enough about all me, but you tell me what you're thinking about all this. And
well, I think it's incredible because it's multifaceted. It's not just about us as healthcare professionals. I mean, I've been a nurse for a long time. I grew up in the Western medicine healthcare system. So to some degree, I think I was not necessarily brainwashed, but you become very much in a box, this linear way of thinking. And it really is not a holistic approach to healthcare. We're taking into account every single person's individual body, what they present with. We don't address the spiritual, we don't address the intellectual and the emotional side when it comes to disease, which is very sad. I mean, I've been doing this for how long now? And I don't see really any huge leaps and bounds in progress for us. I think as alternative medicine has started to catch up, it's created more chaos. It hasn't created clarity.
Yeah.
So I think on the part of the patient, they're more confused than ever. I think on the part of the practitioner, it's more challenging for us. There almost used to be, you're an alternative or homeopathic, or that's your lane. And here we are over here, and here's our lane, and we're completely separate. As we've learned to integrate the two together over these past 10 years, you're really starting to see it start to kind of mesh one with the other. It's become a lot more gray. It's not black and white anymore. And I think it's very challenging, both for myself, having a nursing license. Now that I'm in California, I work under my California nursing license. But while I was practicing in New Brunswick, it always shocked me when I would have another healthcare professional, or a nurse or a physician, come to see me for Bowen therapy. And they'd be like shocked that I wasn't working under my nursing license. I was working under a naturopathic license. And I was willing to take that risk to let go of years of nursing and my stability and financial security that they had become so accustomed to. That fear of, if I walk away from my profession to do something that I'm passionate about, that I know works, that I know that I love and makes a difference in people's lives, that doesn't take precedence. Yeah. So it's no wonder our patients, I think, sometimes get very confused. I'm still seeing it on a daily basis here. Right now, I'm doing IV therapy for a patient of mine doing concierge service that has been through the ringer with the healthcare system. And he's shocked. He's like, why now am I only finding about this stuff? I've been suffering for years. Why did I not know about some of these other things? Why was I not guided by my practitioner, my primary care physician, that these other alternate means for health and well-being were at my fingertips?
Yeah.
And he advocated it and wanted to push me in that direction as well, for it to be comprehensive care.
But I think, as you're speaking, what I'm feeling that is happening more is less of a division between, allopathic and, let's call it, natural, but more of a consciousness that isn't all there yet, but about the patient being self-guided and responsible and intuitive, what they need to find the right practitioner. That really,
and that is what I'm seeing too. We have so much technology at our fingertips now. We have so much information that we can go and find on our own if we're proactive and self-directed to do so. That information sometimes is food for their soul. It's amazing how it opens doors for them to start to realize that maybe there's something else that I can do or try. And it's not all how I have been, socialized in regular medicine to think that this is the only way. It's not always the only way. I think we're a team approach.
Yeah. I mean, I'm anyone in practice that has knowledge like yourself or like myself that is alternative or complementary or whatever we want to call it, knows this. But what's I think is changing is the patient is now losing faith, I believe, in the allopathic system. I think there's been, and in the last couple of years, there's been an awakening to the deep betrayal of the expert. The expert knows all this, and then how could the expert say it's safe and effective when, well, what's the expert supposed to do? Just listen to the government, or just listen to paid people in power, or it becomes really tricky, right? Like, it's like, what do you mean? Like, I've interviewed some, and it's like, what do you mean you didn't do your research? Oh, I we're not actually trained to understand the scientific data. And then it's like, well, wait a minute here, but the data wasn't even available. It was hidden. So how can you actually say something without the informed consent without telling your patient, hey, by the way, we actually haven't seen the ingredients. We
Right.
don't get the results. And we're told it's safe and effective. And oh my gosh, now it's even in some places obligatory and mandated, and it's like, and they're still doing it. Like, you have to tell your clients and your patients, this is the state of the art right now.
Yeah.
Instead of holding on to, I'm an authority because I get to do this stuff. I mean, this is so scary. Anyway.
I know. I think it's what fascinates me is even where we are right now, how far we've come, what we're still learning, what we still have much to learn. When we think that we're masters at knowing pretty much what's going on inside our body and how stress affects us and how it affects our healing and what creates disease and what creates inflammation, there's still a lot we don't know. And that's what I think the average person still doesn't quite understand, that we're still learning. We're still trying to figure out like how these our body systems. I was reading an article the other day from Dalhousie University in Nova Scotia, actually. They're doing this study right now. Obviously, it's a study on mice to see the idea that stress is either innate or a learned behavior, basically. Mm-hmm. And they're doing it on pregnant mice to see when they are really stressed during pregnancy, the hormones that are secreted and how it affects the fetus. Mm-hmm. That those babies, when they're first born, are highly stressed, much harder to calm. The mothers, most notably, usually withdraw from those babies when they're high stress moms post delivery. And this is just recently. So it's like we still don't know some of these things to be able to help our clients the best way we can when we're talking about how to teach them, how to give them tools on how to heal their body from within, to give them that control over themselves. It's we're still, as much as we know, like I say, it's almost frustrating sometimes. I still have patients come into my clinic on the aesthetic side of things when I see patients. It happens every single week that I have a patient come in just by chance. Sometimes it's for cosmetic purposes. They'll be like, I just don't like these jowls anymore. I don't like how I'm getting really jowly through here. And I'm losing the femininity of my face. And they'll come in to have Botox in their masseter muscles. And the first thing I'll say is, do you have ringing in the ears? Fullness in your ears? Mm. Do you clench or grind your teeth? You've got heartburn? Do you have neck or shoulder pain? Oh my God, I have all those things. Has a dentist told you your teeth are wearing down? Yes. Let's get to the root of the problem here. It just amazes me that, like our first responders, which are those dental hygienists or dentists that see patients long before I'm ever going to see them, still don't have that very well-versed, comprehensive idea of health and wellness in the body. And what, for example, just picking the jaw, which is that's my bone of contention.
Yeah, exactly. Yeah. Well, I mean, it governs so much stuff, right? And I mean, I know you've had experience also with dentists directly.
Yep.
You can sort of see the back and forth of it.
You
fix the TMJ, then all the disorders, not just of the mouth, but of the entire body are changed, right? Yep. You would think that a dentist, would have, there are theories out there. It's not that there aren't any, but, many of them don't even discuss the importance of what type of alignment. Is it the teeth first, which is like the facade, right? It's like, it's, sure, it looks good.
Yeah. Oh, I remember being at a dental conference in Toronto once, and it was by an Australian dental practice who had come to do this big conference. And I was in a room with probably 50 other dentists, and he had on the screen, he had this picture that just showed teeth, and he was asking for like malocclusions and what do you think this is? What kind of class overbite, blah, blah, blah. And everyone's putting their hands up on the room and they're like, oh, this is what it is. I'm going to diagnose by looking at the photo. And then he scans back and it shows neck and shoulders from here up. And the person's sitting kind of like this. You can tell the one side of their face is a little different. Not one person picked it up in the room. I remember going to Joe. That person's got major TMJ.
Manon Bolliger here, and I want to thank you for taking actionable steps towards engaging your healing journey and helping others discover their path by watching, sharing, subscribing, and reviewing these podcasts. Every review and share helps spread the word, these different perspectives and choices and options for healing. And to thank you, I'd like to invite you to sign up to my free 7-sequence email tips on health and healing for everyday life. You can go to healerscafe.com tips. Thanks so much.
You can tell, just look at, then they scan out and they do a full body picture. Amazingly enough, they have Bowen practitioners in their practice there, in their dental practice in Australia. And it made me realize how amazing that is, that they're combining for the care of that patient, the best outcomes for them, proper diagnosis, and having someone on hand to be able to help that part while they're doing their part as far as a dentist to give that patient, like I say, those best positive outcomes in the end. And I remember him, Joe, saying to me, he goes, Diane knows what it is. And the guy comes down with the microphone down the aisle. I was like, oh my gosh, I'm gonna be put on the spot now. And I said, I think the patient has severe TMD.
Yeah.
And once they scanned out and looked at the whole body, and he goes, I want to know why nobody else in this room caught this. Because they're trained to look at teeth.
Yeah, exactly. Yeah.
And at no fault of theirs.
Yeah.
Right? That's
the training. Yeah.
That's the training. That's the in the box.
And and it's also the conceit, of not just those dentists, but of all professionals, including alternative professionals, who think this is it. It's inability to go, what if? What if there's more? What if the body is so incredible, actually, that there may just be something that I don't understand? It's like, what's the word in English? Modesty. There's no modesty left in so much of this professional world, which
I've had bodywork people come in to see me at my aesthetic clinic and question, why would you ever do Botox on someone? Doesn't that kind of go against the grain with it being a pharmaceutical with what you do with health and wellness and bodywork? I'm going, no, this is what is the best outcome for the patient. And if I can get them out of pain immediately within 2 weeks, then we can work on the rest. Then they can come back and do Bowen therapy and do TMJ work. We can talk about doing myofascial release. At the same time, I might be able to get them set up with maybe a mouth guard from their dentist, or set them up in something that they can do at home. It's not just one thing.
Yeah.
I'm lucky enough that I get to have that body of knowledge, number one, but it didn't come by chance, right?
Well, exactly. And that's the thing too, right? If they had seen somebody else, it might have stayed there. And then we got problems too, right? It's like,
well, that's right.
Nothing alone necessarily is the solution.
No.
Right. And it's like, we all have a journey, and there's always one door that is open for us to start the healing journey. Yeah.
I think as practitioners, we're all just the puzzle pieces, right? All together.
Exactly.
For the client.
It's funny, Diane, I did not ask you the one question that I ask everyone in every single interview. So I'm going to ask it as we sort of wrap up.
Absolutely.
What is it that got you into, I'll call it the healing arts? You can start with nursing, but then what happened? If you could.
No, I think I was always drawn to people when I was younger. And then for me, knowledge has always been power. It's always been so much power to have more knowledge. So it's always like a monger to learn more.
Mm.
So I did maternal child health for a long time and was very happy to just sit and do my night shifts and in the labor and delivery department. And then moved to California. And then I realized, this is almost 20 years ago now, I started experiencing hip pain.
Yeah.
While I was working in a plastic surgeon's office. And I'd done all the proverbial things I was supposed to do. You know, I'd gone to the doctor, they'd started me on this and on that. And then by the time it got to the point where they were like, okay, 4, 5, 6 months in, I had this quite severe hip pain. It was limping at the time. I was quite sure I was going to need a hip replacement. I mean, it didn't make any sense to me. And I have a degree in kinesiology. So I'm all about functional medicine, wondering what have I done that has created so much dysfunction in my pelvis that is creating this pain. Still thinking pelvis, it was always my hip where the pain was. And one of my clients told me that she'd had a massive car accident and had seen a Bowen practitioner in Rockland and said, you should just go there first before they start injecting steroids in your hip. And I remember sitting on the table and sitting up at the end of that treatment, half laughing, half serious. What the hell did you just do to me? Number one, because I feel relief. How did this just happen with so little movement? And you leaving, I remember him leaving the room, me thinking, where the heck is he going? Like, why is he leaving me alone? And he goes, look, next time you come, I will take 15 minutes of my day to allow extra time to explain to you what exactly it is that I'm doing. Well, I didn't wait. I went home and I just researched it. And to me, that was the turning point. Understanding the neuro response in the body and what happens. I had a lower back that was out. It wasn't even my hip. Yeah. I had total referred pain. It wasn't even my hip at all.
Yeah.
And I never saw him past the second treatment. I was enrolled in a Bowen course within 6 months. I thought, this is crazy. Any therapy that can deliver this kind of a result with like I say, with the knowledge I already possess about the body and still knowing there was that piece that I didn't understand, didn't know, that I needed to know more and learn more.
Yeah.
And it's where I started to understand energy and the level of intention.
Yeah. Yeah.
When you're doing your work, doesn't matter what kind of work it is. For me, putting my hands on someone's body, and as you know, that can differentiate you from other Bowen practitioners or other people who do body work. It comes from a place that is within you.
Yeah.
That's what makes the change.
Yeah, I do think so. I mean, and there's a resonance, between. Yeah, I mean, I was just discussing with another practitioner how, who's also a bone therapist, actually.
Oh, wow.
Yes, in Holland, but she comes from Scotland. But it's like, as we learn more, there's more that comes through us and through our hands, right? And our ability to sense things goes beyond the hands, right? It's like,
yeah,
we're a whole person,
right.
Having a relationship with another person, right? So much comes into our field of understanding.
And like, again, yet another area where we still have not been able to have concrete, like, determining information when it comes to vibrational energy, and that can tell a layperson, this is what's happening. It's not that clear cut.
No.
We may never get to that place. I don't know, but I just know that now we still don't have that that particular science to back up what's happening in the body. But I'm very happy, though, to know that there's more and more clients and more people that are out there that are willing to actually hear, listen, learn, and try.
Yeah. Yeah. Well, I mean, especially because there's been such a mockery of science.
Yeah.
That scientists are really upset, because they've been used, like really abused. I mean, not those who have been paid off, but the ethical ones
Yep.
that still are trying to, come to an understanding of the human body. But I think it's interesting. I was just came across a quote from Einstein. There we go.
Einstein. Yep.
How it's, I don't remember the quote, but how the other end of it is almost like the spirituality. It's almost this unknowing, which is part of the entire equation, right? And so I think that's that idea of also modesty. We can go down one track, and then you realize that the track is a circle. So
Right. Yeah.
And you're going to put it all together, if you're so lucky.
Yeah. Yeah.
So we have a couple more minutes. I just anything that you really want to share, or somebody you've been able to help that you haven't been able to tell other people, without names, but something that that really touched you and moved you.
Gosh, you know what? I am so lucky that I get to do this on a weekly basis, to combine two very different parallel forms of medicine and have them integrate, because I'm able to do that with the level of autonomy that I have here in doing the work that I do, which is really wonderful. I think for me, the biggest impact that I make, or the biggest impact that I have on people's lives, is doing TMJ recognition and work. That is a huge thing. It changes people's lives drastically when they're living in chronic pain, when they're living with a lot of chronic inflammatory processes in their body. If that can be just the one thing that we can actually address, it's amazing how it can create a trickle-down effect. And I get to do this on a weekly basis with patients who stumble into my clinic and don't even know they've got it.
Yeah.
So that, to me, I think is the most rewarding thing in the work that I do, is recognizing that. Like, I have a patient sometimes will come in for just cosmetic Botox, and they'll just by chance happen to say, "Oh, this is going to really help my headaches." I'm like, wait a second.
Yeah.
A first-time client, you've been getting Botox for headaches, and where have they never been putting it where it belongs? Like here instead of here? Because this is just tension.
Yeah.
This is fixing the problem.
Yeah.
And yeah, so I think that's the biggest, most rewarding thing that I do.
Mm-hmm.
I'm so lucky that I get to do that every single week.
Mm-hmm.
Yeah.
Yeah, that's super.
It's a huge takeaway every day when I come home.
Well, Diane, thank you so much for
Thank you.
Your experience and knowledge, and yeah, we should talk.
I know, right? I'm not done yet.
I know. Do you miss teaching at all? Or
I do.
Okay.
I really do.
We should talk, because
I really do.
We're at a turning point where I believe Bowen therapy, in the hands of people with the right experience that could teach it and inspire people at, for the possibility of the body, what it can do. I think people are craving this. So we should talk.
Yes. Yes, we will. I have a daughter heading off to New York, and I will be an empty nester next year.
Okay. Hey, maybe
I'll have nothing but time.
Okay. All right. Well,
it was nice to see you.
All right. Bye. Bye, Diane.
Bye.
Thank you for joining us at the Healers Café with Manon Bolliger. Continue your healing journey by visiting thehealerscafe.com and her website, and discover how to listen to your body and reboot for optimal health.